Hey, Jeff, let's get going.
Good evening. I'm Jeff Badnock, and on behalf of the University of Montana Alumni Association and the Community Lecture Series Committee, it's my pleasure to welcome you to the sixth and final lecture of the 2022 University of Montana Alumni Association Annual Community Lecture Series. This series was established more than 20 years ago as a means to give a spotlight to the many amazing faculty at work researching and lecturing on the university's campuses. The series shares with the community the cutting-edge work in the arts and sciences for which the university is so well known. Like last year, we are mindful of your health and are hosting this year's lectures online via Zoom. We all hope that next year's lectures will
be... sound, maybe.
I'm sorry?
Someone put a message to say there was no sound.
Oh, I'm sorry. Okay, I'm going to go ahead.
I think it's fine.
All right. Since this is not a ticketed event this year, the Lecture Series Committee decided to offer the series to the public at no charge. To support this generous offering, the Lecture Series Committee is grateful to acknowledge the support of First Security Bank, Blackfoot Communications, Kitty Robbins, and an anonymous donation in honor of former University of Montana President George Dennison and his wife Jane, as this year's Lecture Series sponsors. If you enjoy these lectures and wish to support them now and in the future, please feel free to visit the Alumni Association website and make a donation of your own, designating it for the annual community lecture series. As always, these lectures are the result of a lot of work on the part of Community Lecture Series Committee, made up of Kitty Robbins, Joe Batt, Robert Stubblefield, Chris Comer, and Peggy Coeur. Jody Moreau of the Alumni Association Office and student Lindsay House have provided indispensable support in the organization and production of the series. The committee has chosen for this year's series the theme, Our Environment Matters. From the waters of Montana to the wildfires of the Northwest, this year's lectures will explore human impact on environmental sustainability, and how changes in the environment affect our lives and how we live in the world. This year's series will showcase 6 of UM's finest professors as they share rich and exciting research happening at the University of Montana and beyond. As always, following the lecturer's presentation, there will be an opportunity for members of the audience to ask questions so that our experience can be broadened. To do that, simply click on the chat function on Zoom and submit your question. We will get to as many of those questions as we can, but we will have a clear ending point for tonight's event at 8:30. The lecture series has received a media assistance grant from MCAT, now housed in Missoula's wonderful new public library, to record the lectures for later viewing. The lectures previously given will air in order, one each week on MCAT.org, the next 5 weeks on Tuesdays at 5:30 p.m. and again the following Thursday at 7 p.m. In the days following this final lecture, we will be sending you a survey inviting your comments and suggestions to improve the series. In addition, we will be inviting your suggestions for a topic for next year's series, as well as your suggestions of faculty you may wish to hear from. The environment's living things, including people, occupy and rely on for existence are varied and are undergoing change that is both rapid and serious. When we think about these changes, we cannot help but give consideration for the implications of what happens when our environment can no longer sustain us or become so inhospitable that we can no longer flourish. 50,000 years ago, there was a lot of land on the planet that was not occupied by humans. Humans spread and came to occupy the earth. Now, when environmental conditions are not supported for humans and other species, what choices must be made? Who makes those choices? Who moves and where? Dr. Katrina Mullan earned her BA from Cambridge University and her Master's of Science from the University of London. She earned her PhD at the Cambridge University. She came to the University of Montana, where she is an associate professor, in 2012 to teach courses in environmental economics. Her research interests include how people make decisions about land use, and how their choices affect the environment. Her work follows 4 overlapping themes: agricultural expansion into tropical forests, responses to environmental risks, the food, energy, water nexus, and environment and migration. Please join me in welcoming Professor Katrina Mullan.
Well, thank you, Jeff, and hello, everyone. And also, I'm really excited to be closing out what's been a fabulous lecture series. Probably some of you have been here for the previous talks, and certainly the ones that I heard were so interesting, and yeah, I feel honored to be part of it. So in terms of how my work fits with some of the talks that have gone before, then a lot of what some of you have already heard was really focused on kind of environmental processes and what's driving those processes, and how can we think about policies that might mitigate negative effects of environmental change. And that's something that I'm very interested in, and a lot of my research also looks at these kind of drivers of environmental change. But in this case, the work I want to talk to you about tonight is slightly different. It's really focused in on, to the extent that we're having some of these environmental changes, they're having negative consequences, then are there actions that we can take in the short term to reduce those negative effects? So we still want to have policy to try and mitigate environmental changes, but how can we, given that those will take a long time, how can we also take action? How can we also implement policy that might, kind of lower the consequences? And to be more specific about it, what I want to talk to you about tonight is defensive health behaviors. So really, when people are facing health risks, what are the actions that they can take to reduce the likelihood that those health risks or health exposures translate to negative health outcomes? Who takes those actions? And if they do, why do they take them, or why do they not take them? To better understand, are there ways that we can promote things that people could be doing to protect their health? And I'm going to try very hard not to talk too much about COVID tonight, but it's given us lots and lots of illustrations of the types of defensive behaviors that I'm talking about. So we've all seen that when you're facing, threats, risks of environmental exposure, risks of health exposure, then you can wear masks, get vaccinated, spend less time interacting with large groups of people. So we've all got very used to these ideas. But I want to focus on them in terms of what they mean for exposures to wildfire smoke. And I'm going to talk about why understanding how people can respond to and protect themselves from wildfire smoke is really important. And then I'm going to talk about research that I'm doing and that some of my collaborators are doing to try and understand, well, how are people responding? And again, who's responding? And if they're not, why not? What's preventing people from taking actions that might reduce the negative health impacts of wildfire smoke? And so this is, for me, a relatively new area of work. Most of my research in the past has been on drivers of tropical deforestation and impacts of tropical deforestation. But the reason I wanted to talk to you about this work is because it's new work. It's an illustration of some of the great collaboration that's happening at the University of Montana. So I've put in the corner of this slide here the little logo of the Center for Population Health Research, which is a new research center at the University of Montana that's funded most of the work that I'm going to talk about tonight. And it's funding lots of other public health research that's happening at the University of Montana. So I just wanted to highlight that it's really doing fabulous work, and this is just one tiny piece that I'm going to talk about. There's lots of other things going on in terms of public health research by people from all sorts of disciplines within the university. So thank you to the Center for funding all of this work. And just to really highlight, why it is that I'm actually excited about this work is fundamentally because there's such good collaborators at the University of Montana who want to work on these subjects. So these are just a few very happy, smiling faces of some of the people who've been working on the topics that I'm going to talk about tonight. And what I really want to stress is that they're coming from all different parts of the university. So Will Rice and Libby Metcalf, who you heard last week, are professors in the School of Forestry. Tegan Avery is a student with me in economics. And then other colleagues, both faculty and staff and students from the School of Public Health, the Public and Community Health Sciences. And these are just a small portion of the people at University of Montana who are interested in health, interested in the environment, and interested in kind of bringing these two things together to understand how they relate and how we can both encourage environmental improvement and also improvements in health outcomes. So, like I say, this is really what is exciting about this work to me, is these opportunities for working with fabulous researchers. And hopefully I can kind of persuade you that what we're doing is also really exciting for the general public as well. Okay, so where am I going with this? So these are a set of relationships in terms of, why do we want to think about wildfire? Why do we want to think about health impacts of wildfire? And, in a very basic framework that I'm going to kind of introduce and talk a little bit about for context to what I'm doing, we can think about increases in wildfire severity, increases in frequency of wildfires, driven by both climate change and past suppression, past fire management, as well as some other factors. And that has consequences for our air quality. Those of us who are in Missoula are very aware that that has consequences for our air quality. And that in turn creates all sorts of problematic health effects that I'll talk a little bit about. But although I'm going to talk a bit about these things, none of these links are really what I have expertise in. Okay, so I am an economics professor. There are lots of great people at the University of Montana who are studying other pieces of this, who are studying how climate change and suppression influence wildfires, how that affects air quality, how that has consequences for health outcomes. But that's not the part that I know about specifically. What I'm really interested in, and what I'm going to kind of focus in on this talk, is variation in how air quality influences health outcomes. And in particular, given a certain level of air quality, how can we reduce negative effects on health? Now, there are various pieces to this. And so, partly health outcomes resulting from a given level of air quality will depend on individual vulnerabilities that people have. So it will depend on if you are relatively young or relatively old or have other existing conditions that mean you're more susceptible to negative health effects, then those outcomes are going to be worse. It's also going to be affected by individual exposures. So if you have housing that seals less well, you're going to have more daily exposure to air pollution. And it depends on access to medical care. But the bit that I'm really going to focus in on this defensive behaviors part is that there are actions that we can take to reduce some of the negative effects of the air quality outside being bad. And so, as I say, what I want to understand is what are these actions? Are people taking them? And if not, why not? Okay, so that's kind of where I'm going with this talk. But in terms of, what do I think is important about this? Why is this even worth looking at? Then there are a few different pieces. So the first one is that wildfires are increasing. So these are all figures from the study that I've listed at the bottom called The Changing Risk and Burden of Wildfire in the United States. So wildfires are increasing, and as I mentioned, the big drivers are climate change. It's getting hotter and drier, and that leads to more frequent and more severe wildfires. And then there's also just increased fuel loads from previous suppression of wildfires. And there are some very immediate problems that come out of this. So at the same time as wildfires are increasing, development of housing at the wildland-urban interface, so places that are most likely to be affected by wildfires, development in those regions is also increasing. So that puts more properties at risk, and it also increases the likelihood that fires will be suppressed because they're threatening housing. And the immediate obvious impacts are also that suppression costs are going up every year. And not just suppression costs, but increased risk to those who are actually engaged in fighting fires. So that's all happening. But at the same time, these wildfires are leading to this somewhat less direct, somewhat less tangible, but definitely, if you live in the Northwest US, quite apparent cost, which is that wildfire smoke is increasing. The number of days that we're experiencing high levels of smoke during wildfire season has been going up quite dramatically in the Western US and the Northwest US. And that's unpleasant, as well as having the health consequences that I'll talk about. And one thing that this means is that while pollution from smoke is going up, general air pollution is actually going down. So the graph G on the right-hand side is showing trends in pollution from other sources. So because of changes in vehicle technology, changes in power generation, changes in regulation of industry and wood stoves, then pollution is actually improving from most sources. So while things are generally getting better in terms of air quality, they're getting worse when we're thinking about wildfire smoke. And what that means is that whereas in the past, most air pollution was urban air pollution driven by vehicle or industrial sources, increasingly large share of air pollution is now coming from wildfire smoke. And one thing that means is that to the extent that wildfires are influenced by climate change, then in this study that I've taken these figures from, they predicted that wildfire smoke and the health effects of wildfire smoke is likely in the US to become the most significant cost of climate change. The most significant negative effect of climate change will be these health impacts that we're talking about. So they're a big deal. And then when it comes to understanding both what those health impacts are and how can we mitigate those health impacts, then the fact that pollution used to primarily be an urban problem means that we really don't have as much information as we would like about, well, what are the effects of wildfire smoke as opposed to pollution from other sources, and how do people respond to pollution from wildfires relative to pollution from other sources. And we would expect those responses to be different. When we're thinking about urban air pollution, it's usually kind of more gradual changes over a longer period rather than the kind of sudden spikes in very severe pollution. We're talking about different populations. It's affecting rural areas rather than urban areas. And so we can't necessarily transfer what we do know, which is a certain amount, about how people respond when urban air pollution is bad to rural areas, which is why kind of looking into some of these questions is important. And one thing I will say about this kind of relatively more evidence on urban air pollution than wildfire smoke is also because it's more challenging to actually measure air pollution from wildfires, because monitors are more scarce. So mostly there are monitors for air quality, and I'll talk about how many of us might have seen the outputs from those monitors, but they tend to be very prevalent in densely populated areas and much less so in rural areas. So it means that if you're studying, what happens when air quality changes somewhere that there's lots of monitors, then you can see exactly what the air quality is. Whereas in rural areas where there are big gaps between locations of monitors, then it becomes more difficult to actually understand what is the air quality in a given location, let alone kind of how people might behave in the face of that air pollution. Okay, so this was just one. I want to talk a little bit about the health effects of air pollution. And this was just one illustration of one small peat fire in North Carolina, where the author on the slide tried to calculate, well, what were some of the effects of this one small fire? And so, we have a pretty good understanding of how air pollution in general affects health. I'm mostly going to be focusing in on fine particulate matter, which comes from wildfire smoke, but also other sources of air pollution. And, these effects that are listed here are just a few examples, and they're likely to be much larger when we're talking about the large fires that occur in the Western US. There's less known about wildfires specifically, for the reasons I talked about, of less monitors and people haven't been studying it as long. But there's a pretty good sense that there are kind of important acute respiratory impacts of wildfire smoke. So people who are exposed to kind of high levels of pollution from wildfires are more likely to visit the emergency room or be hospitalized with exacerbation of asthma or COPD, chronic obstructive pulmonary disease, and other types of respiratory illness. There's more mixed evidence on what are the effects on cardiovascular disease. And one of the challenges is that, again, this is kind of a data challenge, is that we can observe when people are affected to the degree that they go to the emergency room or to the degree that they're hospitalized. But there's going to be much larger numbers of people who are affected with, relatively mild symptoms, but maybe over a longer period of time, or who maybe aren't showing symptoms, but are still experiencing, for example, a decrease in lung function. So there's going to be, for every kind of very severe case that we can actually count and say, well, this increased as a result of wildfire smoke, there are going to be a much larger number of people who are affected to a lesser degree, but we're talking about more people. So there's a lot of effects that we don't know about in that respect. And this is just one example of this type of thing. So this is a paper by a whole team who are mostly from the University of Montana. And what they looked at was, what effect does wildfire season, or a bad wildfire season in the summer, have on risk of flu in the winter? And so what they found was that, people don't immediately have higher risk of flu because air quality is bad. And that's mainly because the flu season and the fire season don't happen at the same time. But they did find that, kind of comparing counties in Montana, those that had a relatively worse fire season also had increases in cases of flu that following winter. So these effects aren't even showing up straight away, but rather they're showing up many months later, that people are then more susceptible to, in this case, flu. I don't know exactly what evidence there is on wildfires and COVID, say, but there's a lot of studies that have been done on urban air pollution with similar findings, that exposure to pollution in one period of time, many months later, can lead to greater susceptibility to complications related to COVID. So these effects aren't necessarily direct, but there are very substantial health impacts from exposure to wildfire smoke. And those health impacts can start to present at really quite low levels of pollution. So even exposure to some wildfire smoke can start to have negative health impacts, and then those increase as either pollution gets more severe or as the length of exposure increases. Okay, so I said for context, I was going to talk about some of these general links to make the case that this is something that we want to know more about. This is a serious environmental and policy and health problem, certainly in this region of Montana, of the Northwest US, but in the country as a whole and in plenty of other countries as well. But now I want to kind of focus in on this question of, okay, so what about defensive behaviors? What are the things that people could be doing to try and reduce some of these health outcomes? And so there's lots of guidelines, and I'll talk about some of those guidelines on actions that people could be taking. And in general, the first one is find out what air quality is. So recommendations to just check air quality and know, well, when is it bad and when is it less bad? And so these are just some of the examples of sources of information that people access and can access on, well, what is the air quality? So we have information put out by Department of Environment in Montana. The EPA puts these two maps on the left-hand side out, showing both where fires are and where air quality is relatively bad. There's multiple apps available that people use. Weather forecasting sites tend to have this kind of information. I've also put up here in Missoula County, we're very lucky to have descriptions of exactly what the conditions are and what's coming, put out by the county health department. And so the first kind of action that we're interested in is, well, are people looking at this information and making use of it? And then once people have the information, the first kind of set of guidelines is, well, what does that mean for outdoor activity? So one of the recommendations is that if air quality is less good, and we'll talk about how much less good, but less good, then spending less time outside, doing less vigorous activity outside is one of the important ways of reducing the potential negative impacts of that bad air quality. So these are guidelines specifically for children, but there are, equivalent guidelines for adults effectively. And we usually, these kind of color codings have been pretty commonly applied across the different sources of information. So we can think about levels of air quality as being good, where, we can do whatever we like. Moderate, where it starts to be a little bit poorer air quality. But these guidelines are suggesting, okay, you can still do most things. Unhealthy for sensitive groups, where those who are likely to be most affected due to their age or due to their health conditions need to be more cautious. And then unhealthy and very unhealthy and hazardous, where everybody should be taking precautions and reducing outdoor activity in this case. Okay, so I'll come back to these kind of categories and what they imply about things that people might do in practice. And as I said, there's lots of guidelines out there. In Missoula, we're really lucky to have Climate Smart Missoula, an organization who put out loads of information on what is it you can do to try and minimize impacts of smoke exposure in the summer. And so here on the left-hand side are some recommendations for them about, keeping your house closed up. One recommendation is an air purifier with a HEPA filter in it that can actually clean the air within that closed up indoor space. Air conditioning systems, if they have the right kinds of filters, can do that too. And then minimizing other indoor air pollutants coming from cooking or vacuuming and that kind of thing. And then these are other guidelines from the EPA, which are very similar, but also add, there's the option of wearing not a cloth mask like we've been wearing recently, but kind of tight-fitting N95 mask that would filter out some of the pollutants, and even perhaps going as far as evacuation from places where smoke gets really severe. Okay, so there are some fairly consistent recommendations on what is it that people should be doing when air quality is relatively poor and as it gets even worse. And so what I want to know is, who follows these recommendations? Why do people follow those recommendations? When do people follow those recommendations? And this is kind of coming from my perspective as an economist. And I've put up here, this is my preferred definition of what is economics. How people make choices when resources are scarce. And by resources are scarce, then really we mean, okay, we don't have enough time or money or energy or attention span to do all the things that we would like to do. Okay, so everybody has many things that they care about. And so when we're thinking about, actions to protect your health, the starting point is that people care about their health. We're not assuming that people aren't taking actions because they don't care about their health. It's possible that some people don't have the information about the health consequences, but mostly people have an idea that, reducing their exposure to wildfire smoke would be helpful, and they do want their health to be better, they do care about it, but people also care about other things. And so, for example, if we're thinking about the recommendations to stay indoors when the air quality is bad and seal up your house, then you might really care about your health and want to do what you can to protect it, which would involve staying indoors when the air quality was bad. But you might also care about family relationships. And so if your nephew is having a party outside in the park, then maybe it compromises your family relationships if you stay inside in your sealed house rather than going and joining that social activity. Okay, so we're weighing up and making trade-offs between things that are important to us, not just deciding, well, do I want to take action in my health or not? So it's really about, what are we giving up? What are people giving up in order to take these defensive actions to protect their health? And so in terms of thinking kind of theoretically about, well, what are the things that people do and don't do? Then we can partly think about, okay, well, how much do people benefit from taking particular actions? So we can think in terms of actions that are kind of relatively straightforward, but perhaps cost some money, like this is a picture of my air purifier in my living room, which can clean the air inside your house when it's smoky outside. Or we can think of more extreme actions. So this is a photo from 2017 when air quality was extremely bad for a very long period of time in Seeley Lake, just outside Missoula. And then it became a relevant question about, well, should you evacuate? Should you leave altogether and try and stay somewhere where the air quality is better? Okay, so we're thinking about different types of decisions. But for any of these decisions, then, whether this is something that you think is worthwhile depends on, well, how much at risk are you personally? Are you one of these more vulnerable groups or more sensitive groups? And this is kind of where information comes in. Do you know how bad the air quality is? Do you know what the potential health impacts of the air quality are? And do you know the benefits of the potential actions you could take to reduce the chance of those health impacts? And it's also going to depend on, are people willing to take risks? Because none of these health outcomes are definitely going to happen. It's just that increased exposure to wildfire smoke is going to increase your risk of some kind of negative effects. And some people are more willing to take those risks than others, just to do with their kind of intrinsic risk tolerances. But the piece that we're really interested in as economists is, what is it that you have to give up? What is it that you have to go without in order to take these actions? And that is to some extent about, how much did the air purifier cost? I asked my husband and he said it was about $160. That's quite a lot of money. But what we're really concerned about is not, well, how much does it cost? We would all rather buy things that are cheaper and not buy things that are more expensive. And it's not even really about, well, can someone afford that $160 or not, although they may or may not be able to. But it's really about, what is it in practical terms that you're going to have to go without if you buy the air purifier. And depending on your overall budget, having the air purifier may mean going without a new pair of jeans or your weekly meal out, in which case maybe it's not that big a deal. Or buying the air purifier may mean going without gas for your car, or may mean going without repairs to your house. So it's not just a question of, well, do you have that money or do you not have that money? It's about, what do you have to sacrifice in order to, in this case, buy the air purifier. But it's also, importantly, not just about money. So it might be that things take time. And so, what would you have spent your time doing instead of taking your protective behavior? Or it could be other things altogether. So for example, if you were thinking about evacuating from Seeley Lake, then what you're giving up, it could be that you have to spend some money on a hotel room, but if you could stay with a friend or a family member, what you're giving up is being in your own space. And that's just as important potentially as giving up money or giving up time. You're giving up the convenience of your own space, you're giving up access to the things you need. It may be that, you can continue working while you've evacuated, or it may not. So there may be implications in terms of whether you can still work. But whatever we're doing, you're thinking about, what is it that you have to go without? What are the other things that you care about that you have to compromise in order to try and take these actions to protect your health? Okay, so do people take these actions or not? As I'll get into, there's really very little known about, do people take defensive actions in response to wildfire smoke? But there is a little bit more evidence on, do people take defensive actions against urban air pollution? And so I just want to talk about a couple of examples to give you an idea of the types of things that people are looking at and the ways that they're doing it. So this is a map of China, and air pollution is pretty bad in a lot of cities in China. And so this is a study where the authors looked at, did people buy the kind of tightly fitting face masks that would actually filter fine particulate matter when it was relatively polluted in their city. And they took advantage of the fact that it's going to be polluted in different cities on different days. And so they could look at the daily variation in pollution, and they were able to get data on purchases that people made from the largest e-commerce website store in China on, did purchases of these face masks go up? And what they found was that there was an increase in face mask purchases on the days that air quality was worse. And there was a similar study where they looked at kind of indoor air purifiers, which were a much bigger financial investment. And purchases of air filters also went up on days that air quality, kind of days and in cities that air quality was particularly bad. But as we might expect, that effect only held for middle income and high income households and not for the poorest households. So there are some fairly predictable disparities in who responds in terms of these actions that involve buying something. And then this was another study that had some quite interesting results in terms of kind of the timing of people's responses. So this is Los Angeles, and in Los Angeles, they have reasonably often smog alerts. And these are kind of publicized. And as with wildfire smoke, the recommendation is that you don't go outside on a day when there's a smog alert. And so this is work that's similar to what I'm going to talk about in terms of my work, where they were trying to understand, do people change what they're doing in response to smog alerts? And the way they did this was to look at attendance or visits to the Griffith Observatory and the Los Angeles Zoo. So both of these are places where you're being outdoors. And so when there's a recommendation for people to stay indoors, then you would expect visitation to go down. And what they found was that visitation did go down. So if an alert was issued just for one day, then visits to the zoo went down by about 15%, and visits to the observatory by about 8%. So they didn't go down a lot, but there was some response. But importantly, what they found was if there was a second day of alert, then the response was much, much smaller. And a third day of alert, there really wasn't any response at all. So people will hold off going and doing these things for a day. But once there are multiple days of smog alerts, then they revert to their regular behavior. And they did find that children, actually only very tiny children, so under 2s and over 65s, did kind of still hold off going on these outdoor visits for a second day of alert. So their response was a little bit more persistent. And they also found that local residents were more responsive. So local residents were more likely to not go on a day that there was an alert, whereas people who were more likely to be visitors from outside, or I guess this was their one opportunity, were more likely to still go despite the alert. So they weren't seeing a whole lot of changes in behavior, at least from these particular sites, although there was some variation in terms of who was responding. And then the last of the kind of other studies that I wanted to describe was, this is one that actually was one of the few that looked at wildfire smoke. So these are all campgrounds in different parts of the US. And they looked at, did occupancy decrease and did cancellations of campgrounds booked through recreation.gov increase on days when either the campground was within 20 kilometers of an active fire or when it was smoky. And I can't remember the level of smoky, but when the air quality was bad. First thing they found was that across this region, there were a lot of days, like 120,000 visitor days that were affected by active fires and 400,000 visitor days that were affected by smoke. So, and particularly in some regions, which it does look like kind of near Missoula is pretty bad, then up to 10% of camping trips during the summer were affected by wildfire smoke. And they found that people did, not go camping when there was an active fire near the campground, but they found pretty small changes in response to wildfire smoke. So most people, even when it was smoky and they knew it was smoky, still went camping. And they actually did some estimations to try and understand, well, what were the implications of this in terms of what people who didn't go were giving up in terms of, not having their enjoyable trip versus what people who did go were risking in terms of health costs, and found that the magnitude of the health costs for those who did go far outweighed the losses of enjoyment and recreation benefits for those who didn't go, which sort of suggests that there's, people would be better off with more adaptive behavior or more defensive behavior. So this is one of the few studies, but as I mentioned, there really isn't much known about what do people do? Do people actually take precautions to reduce their exposure to wildfire smoke? And so the team, some of the people I showed you the pictures of that I'm working with, decided to look at what are the effects of wildfire smoke exposures or bad smoke days on whether people visit parks and playgrounds. And the reason we focused in on whether people visit parks and playgrounds is partly because children are among the higher risk groups when it comes to wildfire smoke exposure. And one of my colleagues, Erin Simmons, studies specifically, well, what are the health impacts of wildfire smoke for young children and for pregnant women? And so it seemed like by focusing in on parks and playgrounds, then parks might have a range of different people visiting, including young children, but playgrounds in particular are more likely to have young children visiting, or at least parents of young children. And so this is Bonner Park, which is near the University of Montana. This is my oldest daughter, who is now in middle school and almost as tall as I am, on a nice clear day, enjoying the playground. And so now I'm going to get into some sort of technical detail, and it's partly because I think the technical detail of this study is really fun. And so I want to try and convey some of that to you. So what we did was we used data that my other colleague, Will Rice, had access to on locations of cell phones. So there are companies that identify where people are moving based on where cell phones are located. And they gather data from a whole variety of different apps to try and get a representative-ish picture of different types of people. And so what you can do is you identify a specific spatial location. So this picture here is Bagley Park in Boise, Idaho. And the top figure in gray shows the boundaries of the park. And then you can count on any given day how many of the cell phones with the apps that are covered by these companies, but that's a lot of cell phones, how many visits were there to this park, or how many cell phones entered this park. And so we did that and counted up for each day, for each park, how many cell phones were there, or how many visits were there. So we can understand not necessarily how many people were at the park, but on which days were there more people and which days were there fewer people. And then we also separated parks and playgrounds. That's why we had these little donut pictures that we actually took the boundaries of the park without the areas, which are usually smaller, of playgrounds, to count, well, how many people were in the non-playground parts of the park, and then separately, how many people were specifically in the playground. And these little scatter plots are showing those daily counts. These are actually all of the Boise parks and all of the Boise playgrounds. And what you can see is that on any given day, there are some parks and playgrounds that have no visits, or at least none that register, some that have 1 or 2 or 3, and then some that have 1 or 2 or 300, particularly when we look at the parks. So it varies hugely. And then we link this data on how many people are visiting a park on a given day with estimates of PM 2.5, which is fine particulate matter, which is one of the most damaging types of air pollution, estimated across the whole of the Northwest US. So this is just an example from Montana. And I mentioned that we have this problem where the monitoring stations are in the more densely populated areas. And if you're looking to study more rural areas or even small towns, then it's much harder to get information on, well, what actually is the air quality. And so this is data from other researchers from the Center for Population and Health Research, who've actually modeled estimated PM 2.5 based on the combination of monitoring stations, satellite imagery that can show information about air quality, and topography and weather. So they can actually, given the information that we do have, estimate what's the air quality likely to be in the places that we don't have information. And what that means is we get very kind of fine scale estimates of what was the air quality on a particular day in a very specific location, whether there's a monitor or not. And so we link this cell phone data with the air quality data for all of the parks and playgrounds in all of these cities that are on this slide here. And so we selected cities in different locations across the Northwest to capture different likely smoke exposures, different sizes of cities, a mix across different states. So we wanted to get some variety in the types of places that we were looking at. And the idea of this is that on any given day, then in some places the air quality is really bad, in some places it's absolutely fine. And then on a different day, it might be bad somewhere else and good in the place where it was bad before. Okay, so we get this variation over both space and time in what the air quality is like and in what park visits are. But it means that we're not just comparing, parks in Seattle have far more visitors than parks in Missoula, and the air quality is on average better in Seattle than it is in Missoula. Then we might say, oh, look, people visit playgrounds more when the air quality is good, but actually that's bias that's coming in because Seattle is bigger and has better air quality when it comes to wildfire smoke. But instead, we can say, okay, given the usual number or the average number of visits in Missoula or the average number of visits in Seattle, when the air quality is relatively bad for Seattle, how do the number of visits change? When the air quality is relatively bad in Missoula, how do the number of visits change? So we can really kind of isolate the effects that are due to changes in air quality as opposed to just due to differences between these cities. And so this is just a kind of illustration of how the air quality varies over space and over time. So we have information from 2020 and 2021, and we can see that in both Boise and Missoula, the top figures from 2020 show actually a pretty decent summer, and then air quality just got quite bad in the middle of September. Whereas those of you who live near where I do will know that summer 2021 was pretty miserable when it came to wildfire smoke. We had a very long period through July and August and into September where the smoke was really bad. And in Boise, it was similar, but if we get into the details, then we can see that actually Boise was particularly bad in the middle of August, whereas Missoula was relatively good in the middle of August. So we can compare, accounting for the fact that, well, August might have more park visits in general, and August might be worse in general. We can see how much did visits change in Boise, where the air quality was bad in August, relative to in Missoula, where the air quality was actually a little bit better in August. So we get this sort of time comparison as well. And I will leave that one for now to get to, these are the main results we have so far on, well, how are people responding? Are people avoiding these visits to parks when the air quality gets worse? And so these are predicted park visits. The numbers aren't particularly meaningful, but I'll talk about what it shows. So we look at, how many park visits are predicted over all of our cities when the air quality is good, when it's moderate, when it's unhealthy, and so on. And what we find is that, or maybe I can use my mouse, when the air quality is good, moderate, or unhealthy for sensitive groups, so moderate is worse than good, unhealthy for sensitive groups is worse still, by then it's pretty bad, then actually we don't see any reduction in the frequency with which people go to parks. Everyone's going about as much when it's unhealthy for sensitive groups as they are when it's good. Whereas when the air quality kind of shifts into unhealthy, we see a big drop in number of visits. And so this drop is about a 20% decrease. So between when air quality is good and when air quality is unhealthy, we see 20% fewer visits to parks across all the cities in our sample. And then we see a bit more of a decrease, although not so much, when it goes from unhealthy to very unhealthy or to hazardous. And so this is saying a few things. One is that people are responding to air quality, but on the other hand, they're not responding to kind of small to moderate decreases in air quality. And even when it's moderate or unhealthy to sensitive groups, it's still damaging to health. So that's, in a sense, a bad thing that people aren't at least taking these types of actions in those situations. But on the other hand, the guidelines, the ones that I showed you earlier, kind of do focus in on, unless you're in a sensitive group, it's when the air quality gets to unhealthy that people are really recommended to not be spending lots of time outside. So these results kind of suggest that actually people may be paying attention to those guidelines, and actually some of this information is being effective in terms of when it's changing people's behavior. I mean, it may also be that when it gets unhealthy, it's just so unpleasant to be outside. And then the other thing is that although we are seeing a response, there's a lot of people who are still going to the parks, even when the air quality is unhealthy. 20% or 30% is a big decrease, but it's by all means not everyone. And so what do we do with this? As I said, this is kind of preliminary work, and so we're still kind of moving along with it. But things that we can kind of take away from these initial results and some of the prior studies is that people are somewhat willing to take defensive actions, but there's a lot of potential to, introduce policies to encourage people to take more defensive actions, because a lot of people aren't changing behavior. We do see a little bit more of a response among more vulnerable populations, which is good. But we also see less of a response if it's some kind of one-off opportunity that people would have to give up. So this idea of, well, what do people have to give up? It's not just about financial cost. It is, do you have to give up your camping trip? Do you have to give up your one chance to visit the Griffith Observatory in LA because you're a visitor? People are much more willing to give up things that they could do or they could not do, or they could do at a later time. And then the results I just showed you are suggesting that when conditions are sort of moderately bad, people don't seem to be taking action, whereas when they get really bad, then you see a bit more of a response. And there's also some indication, although we're not totally sure yet, that some of this could be because of the way that the information is being presented. That when the recommendation is, okay, now you really should stay inside, then we're seeing more of a response. And then in terms of, okay, where do we go with this? This is really the beginning of a much larger program of research. So the immediate team that I'm working with on this project now want to explore these results more to understand, well, how do effects vary between parks and playgrounds? How do effects vary by neighborhood characteristics? So I said the cell phone data that we have, we don't know anything about the actual owners of the cell phone. We just know that there was a mobile device that came into the area. But we do know on average what types of neighborhoods do people come from. So we know the average kind of age structure and level of income and that kind of thing for the neighborhoods that the cell phones kind of came to the park from. So we know in that sense, who's the general population of visitors. So we can start to understand, what does that tell us about who's changing behavior and who isn't. And then another way that we're trying to get at that same thing of, well, which people are actually responding and who isn't, is to use a different source of data, which is the American Time Use Survey, where people are called up and they're asked very, very detailed information about what they did in the last 24 hours. So exactly how they spent their time in the last 24 hours. And this has all sorts of uses. But the way that we want to use it is to understand how much time did they spend outside? And the downside of this relative to the cell phones is we don't know exactly where those people were. We have some information on their location, but not as precise. But we do have a lot more information on the individual themselves, which can help us understand how different people might behave differently. And then Erin Simmons and Libby Metcalf and I are putting together a survey specifically of pregnant women and parents of young children to understand their use of information about wildfire smoke and motivations for taking action or barriers preventing them from taking action. So to actually talk to people to understand this more that way. And then Libby and I, with collaborators at MSU and elsewhere in UM, are trying to kind of go more detail on information specifically. So how do people use information? And then people that we're collaborating with in chemistry and in computer science are doing work on actually forecasting smoke and when it'll be worse and when it'll be better. So we can think about how people might be able to use that type of information to structure kind of when they do things, and that may make it easier for people to respond. So as I say, this is a whole new area of work that I'm very excited about, that some of my collaborators are excited about. And so, yeah, I'm happy to answer any questions about specifics of this or other things that it might relate to. Yeah, so I'll see what other people have to say. This was good air quality.
Great. That was really fascinating. I've lived in Missoula for over 40 years, and I've seen the summers get much worse over time due to the wildfires and forest fires. So before I ask the questions that I have, just to remind people who are watching, if you're interested in asking a question or making a comment, just do it in the chat function of the Zoom, and we'll curate your question and get them asked to Katrina. In the course of your lecture, you kind of answered a lot of the questions that arose in my mind. But I want to go back to your economic phrasing of the issue. And it made me wonder, do people generally or really have a deep understanding of the health trade-offs they make when they make these decisions to go to the park or not go to the park? And I'll confess, I think I'm bulletproof, that I can handle anything, and I won't go out in bad air just because it's annoying, not because I think it's unhealthy. It's just like I don't like it. But do people really understand it when we give them the air quality alert? It's unhealthy for people with challenged respiratory systems or whatever it is. Do they really understand that even if you're a quote generally healthy person, this is bad for you? Do they really understand that?
I think the simple answer is probably not. And people are going to vary in the extent to which they do have knowledge of this. They're going to vary both in terms of do they have knowledge about it, and in terms of just their general inclination to act on that knowledge. So you were saying, oh, you think you would consider yourself bulletproof. That gets to that kind of risk tolerances of some people are going to take risks anyway, and that's kind of to do with their fundamental preferences. But one of the things that the work with Libby and Erin, where we're going to actually survey people, is really trying to get at is when people don't act, why is that? Because that's what we really need to know if we want to design any kind of interventions, for example. And so, this first piece is to understand, well, do people act? But there is definitely a second piece, which is it lack of awareness, either of what the air quality is? Is it lack of awareness of that can have negative health effects even for healthy people? Is it lack of awareness of what to do, which is a kind of different type of information challenge? Or is it some other kind of constraint? So is it a financial constraint? Is it a what is it that you have to give up in order to take these actions? So we definitely want to better understand that. In terms of the theoretical framework, one way we can think about it is not necessarily what are the actual physical benefits of taking these actions, but more what are the perceived benefits. And then the perceived benefits factor in both what you know about it and how much it matters to you personally. So yeah, we definitely wouldn't assume that people have that detail. I mean, in some of this, nobody knows in terms of, well, how much difference does it make if you go outside for 20 minutes rather than an hour when the air quality is unhealthy for sensitive groups? We don't have that information, but we can still think about, well, people are making some kinds of decisions based on some perceptions that they have about whether those actions are worthwhile or not.
Right. I'm always amazed when we have really poor air quality, when I see the long, lean runners out getting in their 5 miles. And it's like, why would you do that?
Me too. I always see them running fast.
Well, another thing that occurred to me from what you're saying is, and from your slide, I appreciate it when you showed the county health air quality assessment, and whoever wrote it said, it's really gross out there. And it made me think about our messaging. To me, I was delighted to see somebody talking like my neighbor instead of a bureaucrat or a health bureaucrat. So is there anything that you can say about messaging that we hear? When I hear, for example, on the radio, when they give the air quality summaries, I know the language. It just goes in one ear and out the other, and I don't listen to it. It's kind of like sometimes when you say the Pledge of Allegiance, you don't even think about it because it's just you just say it. It's the same thing with some of that messaging. So I'm wondering if you have any thoughts on messaging that we could enhance to make that more effective.
Yeah, I think that's a really good question. And so I will say that those Missoula County reports are mostly written by Sarah Caulfield, who is just fabulous and is wonderful to read, because it's not only the kind of chatty style of, yeah, it's gross out there, but it's also, what I find really useful is, here's some information about how bad it is now, acknowledgement of, we're all sick of this because it's been bad for the last 10 days. And so thinking about, well, what effect does that have? But also about, okay, here's what's coming. So often there'll be pieces in there about, we don't know for sure what's going to happen because it depends on the winds and which fires get worse and that kind of thing. But there are chances, the weather forecast suggests the winds are going to change, or this fire is getting more under control. And so, we might get a break in 2 days' time where things improve slightly. And so maybe that, for me, as part of it, is some of that idea of where we are in time. So, thinking about, what does this information mean in relation to, is this the first day and the only day it's bad? Or, no, it's been weeks and everyone's just fed up. But also, is there hope? What's going to happen next? And so I think that's where, I think there's some really interesting things in terms of how people change their behavior when it's bad for a day versus when it's bad for 2 weeks. And I think that's why I'm quite interested to look at, well, what happens if we can forecast or improve our forecasts of, is it going to stay bad or is it going to improve? Because that has to affect the decisions that people are going to make. So that doesn't get into the style of messaging, but I think in terms of what's being messaged, some of that temporal stuff is really important. And I agree that, yeah, just kind of reciting, it's unhealthy for sensitive groups, so you should stay inside, is not going to do nearly as much.
Well, I think over the last couple of years with the COVID and air quality and so on, I think everybody in the Missoula Valley is just extremely proud and pleased that we have such a dynamic health department. I think they've just done incredible work. One of our viewers, Courtney, asked, are there any coalitions or ongoing campaigns to promote more information on the dangers of particulate matter caused by increased wildfires? I mean, this can't only be the health department's burden to bear. Is there anybody else doing it?
Absolutely. So yeah, I want to put in another plug. Climate Smart Missoula are doing fabulous work to provide information. So if you go to their website, I don't have the address of it, but Climate Smart Missoula, they have lots of information about kind of what the health effects are and what some of the actions that people can take are and different ways of doing that. I think they have grants for people who need to take actions but can't afford it. So yeah, in Missoula, I think that's a really good sort of focal point for those activities. I have less knowledge of kind of wider scale, say, national organizations. I mean, certainly you get bits of information from the CDC and the EPA and that kind of thing as well. But yeah, these are really important things to be thinking about. And one of the things that kind of researchers at want to do is then be able to link with groups like Climate Smart Missoula to be able to think about also what are the interventions that might actually make a difference.
Sure. One of the viewers, and I apologize if I say your name wrong, Tegan, just did a shout out for the Davidson Honors College. He says that the Quest initiative for the year is to advise the city on messaging. So the Honors College is also at work on that.
Thank you, Tegan. And I will say Tegan made my very beautiful graph at the end. So she's the student.
Oh, okay, good. Tegan, thank you, Tegan. Elizabeth writes in, it seems to me that often societal attitudes that you do things no matter what the air quality is encourages people to do their planned activities no matter what. Just as pre-COVID people went to work even when they were sick because that was what was expected. And it took a lot to kind of turn that ocean liner because I've got to go to work. I've got to do this. It's what's expected. My boss expects me to come in. I can't not go to work. So how does that factor into our understanding of bad air?
So that puts so many thoughts in my mind. So one is that I haven't talked enough about how work fits in all of this, because it's one thing to be kind of making choices about, do you go to your nephew's birthday party in the park? And it's another thing deciding, well, do you go to work if you work outdoors? So it becomes much more difficult to take these actions if your work itself is outdoors. But yeah, I think this thing of without there being a kind of acceptance of people changing their behavior, it's much, much less likely to happen. And that, you know, when I was talking about, well, what are some of the takeaways we have so far, this idea of I was describing it as a special event, but even a planned event, people are much less likely to skip that. And it is partly about you've made commitments to other people. And so therefore what you are kind of giving up or trading off against the protective behavior is that much greater. So I think we're a long way from that. And partly that makes me think, okay, well, perhaps if we want people to reduce their overall exposures, one way to do that is to kind of focus efforts on the places where people might be more likely to change. So the individual activities, you know, are you going to go for a run when it's smoky, that kind of thing. And to some extent, accept that it's going to be much harder to have people change their behavior when it comes to these kind of more social, more planned activities. I guess one exception is things that involve children, you know, children's sporting events and that kind of thing. Then there are guidelines on when they should take place and when they shouldn't. So yeah, the main thing is that's just much harder.
Oh, and that Oh, go ahead.
Yeah, no, and I was thinking, so I don't have any great suggestions for how do we change those norms, because that's what it is we want really a different social norm that says, yes, it's acceptable to change your plans when it would be unhealthy to go ahead with them. And I feel like a lot of that did happen with COVID, not in every kind of social group, but there was a norm of not going to work when you're sick, or not going to not meeting up with a friend when you're not sure if you've been exposed recently, or that kind of thing. So those norms did change, but it took a lot for them to change.
Yeah, they did. Well, I think about in Missoula, we have the summer institutions like the summer band concerts at Bonner Park, and the Downtown Tonight event at Karis Park,
yeah,
where literally hundreds of people, that it's the high point of their week. It's family entertainment. It's generally very affordable, and it's something that a lot of people just don't like to give up. And I think there's a lot to that. I want to go back to the beginning of your lecture when you were talking about behaviors. And I think I caught it, but there was one of our viewers or participants, Klaus, asked the question, what is the reason for cooking outdoors during poor air quality? And I think the slide referred to, if there's poor air quality, don't cook indoors, frying and things like that, because of what that adds to your indoor air quality. Is that?
Basically, yeah. So I was surprised by that one too, because we're talking about, stay inside. But one of the things that is notable, so since I've been doing this, then, I've got maybe slightly obsessive about tracking air quality. And so in my family, we have an indoor air monitor. You get these purple air monitors that actually tell you what the air quality is in your house. And it was amazing how much worse it got, and even now when the air quality is good, how much worse it gets with any amount of cooking. And so, yeah, it's really about just trying to keep the indoor air quality as good as possible. And so particularly, I guess, if you don't have an air purifier. So if you have an air purifier, you can cook indoors and then it gets purified and it probably works out. But my guess is that a short period of outdoor exposure while you're cooking is better than making, and then going inside to where it's clean, is better than making the indoor air quality worse and then staying inside for longer.
Sure. And since you mentioned air purifiers, I know that one of the things that the health department did do for people who can't get the air purifiers is they have instructions for getting a furnace filter and a simple box fan, and you can make your own air purifier. And as the summer comes along, I'm sure they'll post the instructions on how to do that, but you can make your own air purifier for inside for $25 or something like that, just using a furnace filter. It's not probably as good as a instrument that's made for that purpose, but it can clean inside air. And if that's a problem for people with, people have a problem with respiratory and they have an income problem, that could be a solution as well. Yeah. Well, we've gotten to the end of the questions, and we're going to make our time. Again, I want to thank you, and I should also thank all the other lecturers, because you're the last one, and I think it's been informative. I've learned something new from every lecture, and I appreciate that so much. And I'm glad that the university has people on faculty teaching and lecturing. It seems to me, I kind of wish I was a student again, because there's a lot of things that are going on that we're seeing in these lectures that look like it would just be entirely engaging. And for some reason, I don't think the faculty are as scary to me as they were when I was 18. I mean, I think
don't think we're that scary. Not even.
Well, when I was 18, I was terrified. But I'm very proud of all of you, and I appreciate that you've been part of it. And to our listeners, come back next year in 2023, first week in February, we'll start our 2023 community lecture series brought to you by the Alumni Association. I want to thank everybody for tuning in and participating and sending us your questions. And until next year, I wish you all a happy year. Thank you for being with us.